Centralized waiting lists are a mechanism used to deal with problems with long wait times and poor access to a given service. They are used in different contexts to manage the asymmetry of demand and supply for a given service. In healthcare, centralized waiting lists have been used for various types of services, most commonly for elective surgeries. When designing a centralized waiting list, decision makers should take key elements into consideration. The aim of this presentation is to describe the different types of centralized waiting lists found in the literature and to analyze key considerations that can help guide the design of a centralized waiting list in healthcare. Three main types of centralized waiting lists were identified in the literature: queuing, categorization, and scoring. Queuing is the simplest form of centralized waiting lists. Under a queuing mechanism, patients are registered on the waiting list and receive care on the basis of the date they were registered on the waiting list, regardless of their clinical condition. It is a first-come, first-served mechanism, which is based on the principle of equality of access to a service. Everybody waits the same amount of time, regardless of their clinical conditions. The implementation of this mechanism implies that the supply of the service is close enough to meeting the demand for the service. Categorization is a more complex type of centralized waiting list. As opposed to the first-come, first-served approach in queuing, categorization prioritizes patients on the waiting list. It is therefore a demand-based management mechanism and is used when the demand exceeds the supply for a service. Under categorization, based on their current medical information, patients are assigned to a category representing their medical need. Categories are associated with recommended waiting times in order to prioritize patients with more needs. Categorization does not provide equality, but rather aims to improve the equity in the distribution of services. Those with more needs receive the service more quickly, rather than having the sick and the healthy wait the same amount of time. Assignation to categories is generally done by a healthcare professional and based on established guidelines. Scoring, similarly to categorization, represents demand-based management of a centralized waiting list, but uses a more rational approach. Under a scoring mechanism, a standardized tool is used to assess a score based on the patient's needs, which is linked to recommended wait times. Patients' needs are assessed based on medical and/or social information. The patient's rank on the waiting list is determined by the score. So what are the elements decision makers should take into consideration for designing centralized waiting lists? The first consideration in choosing the most appropriate type of centralized waiting list is the level of asymmetry between the supply and demand for the service. In a system where demand exceeds supply by a large margin, demand-based centralized waiting lists, such as categorization and scoring, are recommended as they try to guarantee, in a long waiting list context, an equitable access for the most needy patients. In a system where demand and supply for services are close enough, supply-based centralized waiting lists, or queuing, where all patients have equal wait times, should be implemented. The second key consideration is related to monitoring. The literature shows gaming behaviors with every type of centralized waiting list. For instance, patients' registration date may be artificially reset to meet target waiting times. Or, providers may avoid certain types of patients, leaving them to wait much longer on the list than lower priority patients. Therefore, close monitoring of centralized waiting lists is strongly recommended in order to detect and address these undesirable behaviors. The last consideration is that for them to function properly, centralized waiting lists must be based on accurate, up-to-date information. As such, centralized waiting lists should be designed so that patients' information is regularly updated. This literature review on centralized waiting lists is part of a research project we are conducting on analyzing centralized waiting lists for unattached patients in primary healthcare in 6 Canadian provinces. If you have any questions regarding centralized waiting lists, please do not hesitate to contact us.